Do you have high blood pressure? Do you have a patient who is on treatment for high blood pressure, or what is in other terms referred to as hypertension? Listen to this carefully. Among the many antihypertensive drugs, which have various side effects, of course, after long term use, there is this one drug that has been singled out. And in 2019, the National Drug Authority issued a safety notice on an antihypertensive drug called hydrochlorothiazide. Now, a global study was done, and it was found out that especially for black African users, there were serious side effects that were affecting people that were using hydrochlorothiazide, especially when it was used as monotherapy. So, the main side effect that they brought out in this study was the development of non-melanoma skin cancer after long-term use of hydrochlorothiazide. Now, hydrochlorothiazide appears in some combination therapies, like you might have a brand name that you're familiar with that is called Telsa H. Um, there is another, there are various brand names, but mark out the ingredient of hydrochlorothiazide. It is a group of drugs we refer to as thiazide diuretics. These are drugs that treat blood pressure, but by increasing urination to reduce the blood volume and thereby lower the blood pressure. But this drug has been found out to cause a number of side effects that are very harmful to the body. So imagine you are treating high blood pressure, but then the person over time ends up developing other complications. So besides the non-melanoma skin cancer, it has been found that the users suffer from diabetes. They develop diabetes. The users also develop conditions that are related to affecting the central nervous system. So the user will develop dizziness. The user will develop confusion. Can you imagine you are taking antihypertensives and then you start feeling confused? You know, it is such a serious situation, but many people are not aware of this, and that's why I use this moment to bring it out. So there are side effects like hypokalemia, you know, um, that, that result in inflammation of joints. So the person will develop arthritis and gout. Gout is a form of inflammation on one of um, the joints on the foot. You know, so once you develop these symptoms as side effects from long-term use of hydrochlorothiazide, you need to visit the doctor for help. They will check your blood. They will find out your sodium levels. They will find out your electrolyte levels to check out for any imbalances. And then they will recommend the right solutions. But in the meantime, the problem of hypertension is with us. But it is recommended that we should not rush to do pharmacological interventions. Um, Health workers need to engage non-pharmacological interventions to patients as they monitor to go to the next level, because these synthetic drugs come with a number of side effects that are harmful to the body. So for every health worker at any given moment, you have to do a risk-benefit analysis before you recommend certain drugs for people. So in the meantime, what the National Drug Authority has issued out is a safety notice. There is no ban on the use of that drug, but it has to be used with precaution. You must check the history of skin cancer of the patient. You must check their report on photosensitivity. when they are exposed to sunshine and things of that kind. But then also, what people that are suffering from these problems should do, they should ensure to drink a lot of water through the day. You should ensure to do physical exercise, have an active physical exercise routine, at least 1 hour of physical exercise every day, and then do laboratory checks on the regular to check how your body is responding to the medication you take. So that's what I wanted to speak about to you today. Um, that there is that drug, hydrochlorothiazide. It's a thiazide diuretic, and safety concerns were raised by the World Health Organization and locally our National Drug Authority. So if you are using it, you must use it with a lot of caution. Ensure that it is not taken as a monotherapy. You should not swallow it alone in consultation with your health worker. They should combine it with either beta blocker, you know, and if you must take it, also ensure to use the lower dose, the lowest dose on the market, 12.5 milligrams. Avoid bigger doses because the bigger the dose, the more and the more severe the side effects. Thank you so much, and see you next time.